So welcome everybody. My name is Chidima Ndubuisi. Um, I'm a fellow student here, and we're going to be having these sections. Please, we can just all mute our mics. So I'm recording for the benefit of those who are not present. Sorry about the issue with the Google Meet. I know that I understand now that it takes a lot, the Zoom classes Zoom takes a lot of data. So I think I would find a way around it such that I would find a way to register for or subscribe for what's it called for the Google Meet so that we'll still have the recording of these classes. Yes, so it's going to go like this. We're going to follow the material. So this was the material that was shared on the group. We're going to follow this material and we're starting from the beginning. So you don't have to worry, say you've not read it or anything. No, we're starting from the beginning and then we're going to see how far we can go. So for today, it's going to be an hour. All right. Okay, so this is MPH. Please, can we mute our microphones? This is
Wait, Kamaran.
MPH. Please, can we mute our mics? This is MPH 8107, Survey and Research Methods for Public Health. So when we go down, we see the contents, and then we're going to start from session 1. From study session 1. So study session 1 is Introduction to Public Health Research. That is study session 1. All right. So first of all, there's a brief introduction to public health research, and then it goes ahead to just, talk to us about what public health research is all about. So public health research is Please let us mute our microphones. So public health research is basically research, but in the field of public health, right? And it's multidisciplinary in the sense that it is not just when you say public health research, you're not referring to just one thing. There's a lot of components under public health research. So it is disciplinary. The reason it is this way is because when we want to talk about anything that relates to health, it is usually multifactorial. What I mean by that is that if we want to talk about, for instance, let's say maternal mortality, that's women dying due to pregnancy related causes, it's not just one thing that is going to cause it. The things that contribute to all of this to these issues, they usually span across so many disciplines. So you would see that it spans across like sociology and anthropology, because there you now want to see that there you're going to see that the societies that people belong into, or the culture of people, it also affects their health behavior, their health seeking behaviors. And so you see that people from certain society may have better health outcomes or like better ways of living compared to people from another society because of different kinds of beliefs. So some people may believe, no, it's better for us to use this thing when we are ill. Don't go to the hospital, or do it like this or do it like that. And then all of that contributes to the reason is going to contribute to health outcome. So that's one. Another thing could be genetics. So we're now talking about biology in this case. Another thing could be economy. You can't extract or you can't subtract health from economy, because you find out that there are like things that would affect people of low socio-economic status, and there are things that would affect people of high socio-economic status. So there are things that, for instance, diseases that will be more amongst people who are poor, and then diseases that will be more among people who are rich. So when you look at all of these things, you see that Please, can we mute our microphones? Please, can we mute our microphones? Gini Kachi Igwe, I think your mic is unmuted. I don't know who else. Please, can we all mute our microphones? Okay, so you see that it spans across a lot of disciplines, even environmental health, because imagine that we don't have good drainage systems. Imagine that the sewage systems in homes, they are not built properly. All of these things, they all have a way to tie back into health. So when we say public health research is multidisciplinary, that is what it means. It means that we're not just health issues are not often caused by one thing. Public health issues they don't have just one particular cause. There's going to be so many factors that are tying into to result in whatever it is that we are seeing. So let's say gastroenteritis, or let's say cholera, for instance. You will see that the person would most likely live in a place where they don't have access to clean water. Now, when we look at that factor alone, we're already seeing environmental factor coming into play. We're already seeing socioeconomic factor coming into play. So a lot of things will always contribute to results in public health issues. So that's why they say it is multidisciplinary. Now, it is a multidisciplinary field, and one of the things it does is, or the things it does is that it looks into causes, distribution, prevention of diseases and health conditions within populations. So it's looking at what is causing this problem. First of all, it identifies that there's a problem. Then public health research says, what is causing this problem? We have to find out the causes of this problem. And then, how are these problems distributed? Who are the people being affected? That's what we mean by distribution. Who are the people? What population are being affected? Is it, let's say, children under the age of 5 that live in rural communities? Or is it, let me say, adolescents that live in urban societies? So who are the people that are being affected? That is distribution. Then prevention of diseases and health conditions. So beyond looking at, okay, we identify that there's a disease. We identify that, okay, it is distributed within certain populations. It is not stopping there. It doesn't stop at just identifying. It also goes beyond to say, how can we prevent this? How can we make this better? So prevention is a key word when we're talking about public health. Is like something we're going to hear over and over and over, because that is what makes it different from, let me say, the usual medicine. So if you see, like, maybe doctors, clinical practice, what makes a doctor who is in clinical practice different from a public health physician is that a doctor is interfacing with people who already have diseases, people who have illness, people who have departed from the state of health. Those are the people that the clinical physicians are looking at. But public health research, what makes it different is that it's looking at how can we even stop it, if it is possible for us to stop it so that you don't even have to go to the hospital. That is what public health research is looking at. And then the other key word that we are looking at when we look at public health, something that we should always remember, is that it is studying populations. Public health is not just looking at one person. It's looking at populations. It looks at communities. It's looking at groups. That's what it looks at. So while a doctor who is in clinic is going to be looking at one patient, after we study public health research, we are not going to be concerned about just one patient at a time. We're going to be looking at communities. We're going to be looking at populations. So we're going to be saying what kind of disease is more common in this community? What are the health needs of this community? We're not going to be focused on individuals. So that is the thing we have to note about public health. So public health research is multidisciplinary. It looks at causes, distribution, and prevention. And it's doing all of this within populations. It's not concerned about just the individual. So that's something we should have in mind as we go on. Now, public health research, it plays a very important role when we talk about healthcare policies, right? So there are healthcare policies are like there are, you know, like things that are put in place by the government or by policy makers to ensure that populations live healthy, right? To promote health within populations. And you can't make policies without evidence. You can't make policies if you don't know what is working and what is not working. It is public health research that will now say, we think that if kids have mosquito nets in every house, if every house have a mosquito net, we think these kids are going to be healthier. It is public health research that will find out the evidence and say, okay, so we've looked at it, we've looked at different communities and we've done our analysis, and now we can say that this is what works, or this is what doesn't work. So public health research ties back into health policy. It helps to improve healthcare delivery and address global health challenges. All right. Now, how does it do all of this? The major ways it does this, when we talk about research, like the major ways, the methods are qualitative and quantitative research methods. So I'm going to explain that for us so that we can get it. So I think most of us would have done research, maybe during our undergrad, would have done research to some extent, or even if we've not done research, we would have come across research papers online or stuff like that. So qualitative research and quantitative research, they are like two different research methods or ways of doing research, right? I would explain the quantitative first, and then it will help us understand the qualitative. Now, the quantitative research, one of the key things in quantitative research is that we're very interested in numbers. That's why we say quantitative. If you remember when we did quantitative and verbal reasoning in school. So quantitative is number intensive, like it's numbers that we're going to be looking at a lot, right? Quantitative is done when we want objectivity, when we want to be objective, where it's not just about what people feel. We want to be objective. We want to deal with numbers. We want to be objective. That is quantitative research. And it is usually done when we want to test a hypothesis. So as we go on in the course, we'll probably come across that. So it is done when we want to test a hypothesis. There's something called hypothesis and hypothesis testing. So, you know, you're going to have your null hypothesis and the alternate hypothesis, and then you have to now do some statistical analysis to now decide which one holds true, right? So in those cases where we want to be very objective, that is where we look at that is where we use quantitative research. And quantitative research, like I said, it deals a lot with numbers, and also it's going to involve like a larger sample size. The sample size are usually quite, you know, a lot, like maybe in hundreds, and it can even roll into thousands thereabouts, right? So that's that. And then the method of analysis for quantitative research is statistics. We do statistical analysis for quantitative research. So that is one way of doing research. So an example of that is when we are saying maybe we want to do a research in a hospital and we want to know, is there a relationship between patient satisfaction and waiting time, and like how long a patient waits in the hospital. Now there we are going to be employing a lot of statistical analysis for that. Now, the other one is now the qualitative research. Qualitative research is different in the sense that qualitative research, what we are looking at is like people's experiences. We want to understand their experience. It's usually important for cases where we need context, right? So you want to understand perception, you want to understand experience. That is where qualitative research comes into play. So an example of that would be we want to explore the experience of patients in their use of a healthcare system. So you can be asking the patient, okay, what challenges do you face when you come to the hospital and say you want to see a doctor? Tell me about your experience. So in those cases, it will be like story, it will be like a narration. Like the person will be telling you that, when I come, I will leave my house very early. I will leave very early, and then I will come there, I will sit down, I will wait. Oh, my entire day we just go because I want to see the doctor. Now, that is qualitative research. You are looking into people's experiences. It is different from quantitative research, because quantitative research, what I will ask you is, what time do you leave your house? What time do you get to the hospital? Okay, so it is this amount of time that you spend when you want to see a doctor. That's quantitative research. But qualitative research is story, and story we define basically. So that's like the difference between qualitative and quantitative research. And qualitative research uses things like interviews, key informant interviews, focus group discussions. Please, let's mute our mics. So there are different ways of gathering data in qualitative research that is different from how we get data in quantitative research. Both of them have their roles in public health research. Now, there's a third one, which is just like a mixture, a combination of both, and that is called mixed research, like mixed methods of research. So it combines both qualitative research and quantitative research. All of this is because, sometimes one may not be enough to capture. Please, human rats, can you mute your mic?
Okay,
Because
sorry.
one may not be enough to like capture the entire thing that we are looking for. All right. So, and then as against the quantitative research, qualitative research, just like few persons, like maybe 50 thereabout, like few people. That is what we usually involve in qualitative research. All right. So, if we go down to the next paragraph, you see that it says that public health research, it covers a wide range of topics. We've already mentioned that earlier. So it includes epidemiology. Epidemiology, you are looking at determinants of diseases. You are looking at the causes, the distribution of diseases in epidemiology. And then we said health behavior, that's where sociology comes into play, environmental health, health system. So everything ties in. So it's a field that covers a wide range of topics, right? And now we've talked about the different method, that is qualitative and quantitative. So we're going to go down. I think we've done okay with the introduction. Okay, so we have the learning outcomes for this study session 1. It says we should be able to define public health research and distinguish it from other forms of research. We should identify the key characteristics and objectives of public health research, explain how it contributes to disease prevention and health promotion, and it goes on and on. I think that's something we can study personally. So we'll go ahead to talk about, we're now going to session 1, study session 1 properly. So it begins with the definition of public health research. Okay, so it begins with the definition of public health research. So public health research is the systematic investigation and analysis. We'll put it in our head. Systematic investigation and analysis. So systematic means that it's not vibes and inshallah. There's a method to it. There's a way to do it. You cannot just do it and say, this is how I feel like doing it, and that's how I want to do it. No. There's a framework. There's something you have to follow. There are protocols that you have to follow. That's why it is systematic. It's not just based on, everybody do it the way you want. No, there's a method and you have to follow that method. And if you are going to deviate from that method at any point in time, you have to justify why you are deviating from that method. In fact, when you want to write something like review, when we start doing research, there's like primary, secondary research, and under secondary research, there are things they call reviews. Now, when you want to do a review, for instance, you would need to first write a protocol to say, this is how I am going to do these reviews. And they are like guidelines, strict ones that you have to follow. So they are like Prisma guidelines and all of the rest. So you can't just do it based on, and this is how I want to do it. No. And the reason why that is because remember that we are going to make decisions based on the outcome of our research. We're not just doing public health research because, it's cool, like we want to do it. No, we're doing it because decisions are going to be made from the outcome of this our research, and that is why it has to be reproducible. We have to be sure that you are not being biased in the way you are doing it, that you're not saying you did not get at a point and be like, no, let me just tweak the method like this. We want to be sure that you are following it the way it should be, so that we can trust the result, so that it can be valid, so that it can be reproducible, so that if somebody in another place wants to try that same thing that you did, they will be able to follow it and do it. So it is systematic. It's a systematic investigation. Investigation means we are looking for something. There's something we are searching for. That's why when we want to start research, it will usually begin from, what is your research question? What is the question that you want to answer? So that's why it says here that public health research is a systematic investigation, then and analysis. So it's not enough to say, yeah, well, this is something this is a question we want to answer. We're looking into this. Then you go, you get data from the field, and that's the end. No, your data from the field or any data we get from the field doesn't help anybody. We have to analyze that data. Whether it is quantitative research or qualitative research, we have to analyze it. So earlier I mentioned that for quantitative research, it is statistical analysis. For qualitative research, there are things they call like thematic analysis. You analyze based on themes. So the point is that whether it is a qualitative research or whether it is quantitative research, there's going to be analysis. So it is not enough for you to go and say, okay, I'm investigating, I've gotten data. No, you have to also analyze that data, because that's the way we're going to make sense of it. So public health research is the systematic investigation and analysis. Systematic investigation and analysis. Now, what is the goal of this investigation and analysis? The goal is aimed at understanding health-related issues. Remember that it is health we are all concerned about. So this systematic investigation and analysis, the aim is for us to be able to understand health-related issues. Now, these health-related issues, is it in individuals? No, that's not our main concern in public health. In populations, like whenever we say public health, let's always remember populations, communities. That's what we are looking at in populations. So we want to identify the determinants. What are the factors that can influence? What are the determinants of health and disease in populations? Now, it does not just stop at, okay, we've investigated, we've analyzed, now we understand, and we can talk about the risk factors of this health event. We know the risk factors for infant mortality. We know this, we know that. It doesn't stop there. We go ahead to also develop interventions. So intervention is part of public health research. So you've seen that there's a problem in this population. Now we have to develop interventions, because at the end of it all, what we are trying to do is to improve health outcomes. We want health to be better for everybody. We want to reduce health disparities. That means, for instance, between groups, between Black or white, between rich or poor, we want to reduce the disparity. Everybody should be able to have access to healthcare, and everybody should be able to live their lives without disabling diseases that could have been preventable. Okay, so that's the definition of public health. So we'll just read through the definition and internalize it. Always remember, it is systematic investigation and analysis that we are doing. And the aim is to understand health-related issues in populations, not individuals. And we want to identify what are the risk factors, the determinants of health and disease. And then we now go ahead to develop interventions that will improve health outcomes and reduce disparities. So that's the definition of public health. So I think by the time we study it individually, it would make more sense to us. Okay, so the next thing here to talk about is the importance of public health research. And I will just like read through it very quickly because I think we've already talked about it in passing. So it helps us to identify health problems. We've already said that. It helps to inform policy and decision making, improve health interventions, reduce health inequities, enhance disease prevention, and advance science. Okay, so we're going to move ahead and talk about types of public health research. Please, I want to drink water. I'm coming. Okay, so types of public health research. Now, there are different ways to like categorize research. There are different ways. We've already talked about quantitative, qualitative, and mixed methods earlier. So there are different ways that you can qualify research. Um, Now this research here is they just listed like the primary types of research in public health. So here we have epidemiological research. So epidemiological research, the goal of epidemiological research is to understand distribution. Once we hear epidemiology, just think about distribution determinant of disease. DDD, distribution determinant of disease. So once you hear epidemiology, that is what it is looking at. So the goal is to understand distribution in terms of person, in terms of place, in terms of time. What do I mean? It wants to know who is affected by this disease. That is the distribution in terms of person. Who is affected? In terms of place, where? Is it people in the urban areas? Is it people in rural areas? Is it people in low middle income countries, or is it people in high income countries? Like, where is this thing happening? It wants to understand when, because some things could be seasonal. So when is it happening? Malaria, for instance, some of these things have a particular time where it just the numbers go up, the incidence increases. So we're trying to understand in epidemiology distribution. And we just said when you hear epidemiology, think of DDD, like distribution and determinant of disease. Distribution and determinant. Now, under distribution, we now said that you are looking at who is being affected by this thing, where the people who are affected, the population, where are they, and when does it happen? That's distribution. Then when we talk about the determinants, there are a lot of things under determinants. So determinants are things like, they are like broad factors can that can have effect on health. We've already mentioned some of them. We said socioeconomic status. So it's there. Educational level, you will find that there are some things that would affect people who don't have education, and there are things that will affect those that will affect anybody. So those are determinants. Environment. So there are things that would determine diseases and health. So that's what we're talking about when we talk about determinants. So we have distribution and determinants of health and disease. Okay, so it is in epidemiology that we are looking at all those prevalence, incidents, morbidity, mortality, and all of that. That's under epidemiological research. Now, the next one, that's A. So the next one is health systems research. So health systems research basically is looking at how health systems function. Is looking at service delivery. For instance, what we said earlier, you want to evaluate the waiting time, how long patients have to wait before they see doctors. Another thing is quality of care. You want to say, okay, in primary healthcare facilities versus secondary health, what's the quality of care? In private versus government hospitals. That's health systems research. Another thing under health research, system research can be health workforce. We are looking at what is the impact of, for instance, you can say, what is the impact, how does staff shortage when we don't have, like when we talk about brain drain, that our healthcare professionals, they are leaving the country. So how does that affect our health indices? That's health systems research. Financing is also there, leadership, access to medications. Technology is also there under health systems research. How can we use technology to improve healthcare access or healthcare affordability? Is under all of this under health systems research. Then the other one there is clinical research. Clinical research basically is like just trying to understand diseases and test treatments to know, okay, which one works, which one doesn't. Then we have what's the next one? Social and behavioral research. We've already said it before that people's social or cultural beliefs have a way that it can impact their health-seeking behavior. So the example they gave here is vaccine acceptance. So there's something called vaccine hesitancy. You see that there are some people who are very hesitant to take vaccines. If COVID vaccine come out, they will say, no, I'm not sure we want to take it. If polio comes out, no, maybe there will be a reason. You say, no, because of this, we can't take it. Another vaccine, just like that. So people's social and cultural beliefs have a way that it impacts their health-seeking behavior. Then policy evaluation is looking at, okay, we've made policies, we've set programs in place. So let's see how we can improve the design and implementation of these policies. And then environmental and occupational health research. So you can study things like occupational hazards. Please, let's mute our mics. So you can study things like occupational hazards, the effect. Please, let's mute our microphones. And let's see. Usman, please, can you mute your mic? Thank you. So we've talked a lot about those ones, and then there's global health research. So this research now is not just things that affect just like small communities. Global health is basically worldwide, and a perfect example is the COVID pandemic. Okay, and then there's community-based participatory research. So these days, we are moving away from the model where the researcher and the team, the research team, the public health research team sits down somewhere and, design a research program and, carry it. And somebody sent me a message that the link is requesting for passcode. Please, can somebody unmute and let me know, like, did you request for passcode? Huh?
No, no. It's not
Okay.
requesting for passcode.
Okay. Thank you.
No,
Okay, so
no.
okay, thank you. We can mute now. Thank you. So we're going away from the model where, the public health research team just sits down in the office or sit down somewhere and design the entire study, design the research, and then say, okay, let's move to the community and go and carry out this research that we want to do. We're now moving towards something called community-based participatory research. So it's a case where we are doing it with the community. Every step we are working with them. So we're not just assuming that, hey, this is the problem they have in that community, or let's see that these are, no, we're going to go to the community, we meet the spokespeople there or the elders there, and then we sit down with them, discuss with them, and find out what are the problems, what are the health problems in this community. And then we design the research, the study with them. So that's community-based participatory research. Okay, so we're going to move ahead. So the conclusion is that public health research is essential for understanding health challenges, developing interventions, shaping policies that improve population health by utilizing diverse research methods, including qualitative and quantitative approaches. Researchers can generate evidence-based solutions to prevent diseases, promote health, and reduce disparities. So it's plenty talk, plenty talk, plenty talk. We move on to part B. I'm making progress. Okay, so part B is now talking about research study designs in public health. You remember when we said that public health research, it is systematic. It is a systematic investigation and analysis. So now we want to talk about study designs, and study designs are like part of the frameworks that guide us when we are doing or when we want to carry out research. Just imagine it like if you live upstairs and you have a staircase, you see that most times they will also, put something like a guardrail that you hold when you are climbing the stairs, so that you will not just fall down. You are trying to come down from your steps and there's nothing by the side to support your weight, or there's nothing by the side to guide you, and then you see that, okay, you've fallen away. So that's like what study designs are. They are like frameworks. They guide us. They guide the systematic investigation of health-related issues, right? So these study designs, they can be categorized into different, they have different categories. Some people use 3 categories, but here it is 2 that was mentioned. So there's the observational and experimental approach to research. So I'm going to explain the observational and then explain the experimental. So for the observational research, is basically as the name implies. We are looking at something, we are observing a phenomenon, we are observing a health event, we are observing a population and how they interact with certain receptors and the result, the outcomes. We're just observing. We're not doing anything. As against experimental approaches where the research, you now have to do, there's an intervention. That's what makes it different. So for an observational research, I can just be studying. I'll say, okay, let me even see how many people in this population, like how are they faring with what's it called now, with mosquitoes and malaria. And I'm just observing to see, okay, this population, it seems they have a lot of people that come down with malaria. That's observation. But when we now talk about experimental approach, or there's some people will refer to it as interventional. When we now talk about that one, it now goes beyond just observing. You now say, okay, let me give mosquito nets to this community and not this other community, so that I will see which people will come down more with malaria. That's now experimental. That's interventional. You introduce exposure, you introduce something, an intervention. Please, let's mute our mics. you introduce an intervention and say, let me see what the difference will be. Those who had this intervention versus those who did not have this intervention. It can be vaccines. You say, this vaccine that we've made, let's see if there's an actual difference. Let's see if it makes a difference. So let us give it to some group of people and not give to another group of people and see if it is actually going to cause any difference in outcome. Now that is interventional, that is experimental. And it is different from observational. Observational, you are not doing, you are just observing, you are not introducing anything. So those are like the two broad ways that we can look at research. Now, they are under observational, there are like different types of study designs under observational. And under experimental study design, there are also like different types of studies under the experimental study design. So I'm looking at our time, and I think I'm going to talk about the experimental study design, and then in the next class, we're going to talk about the observational study designs. And why I want to do it is because the ones under experimental, they are not very many. So we can just talk about those ones and then focus on the, what's it called, on the observational study designs. So for experimental studies, there's usually something called that intervention that we've talked about. And there are like three types of study designs under experimental research. So number one, we have the randomized control trials. Number two, we have the non-randomized control trial, which is just like the opposite of the first one. And then we have the quasi-experimental design. So I'm going to explain these three, and I think that's where we end for today. So when we talk about randomized controlled trials, this type of research is like one of the top research in public health when it comes to evidence synthesis. It's like one of the top, like randomized controlled trials is at the top when it comes to evidence synthesis. Of course, there are now other things on top of it, like systematic reviews and all the other ones. But this one is like a very key type of research. And why it is key is because this is one research where we can establish something called causality. This is one research where where you finish doing it, you can now say that this causes this. In public health, we are usually very modest when we want to talk about causality. So for some other studies, the best you can say is, okay, I think there's an association between A and B. I think that people who don't go to school, I think that there's an association between poor health-seeking behavior and not an education. And like people who don't go to school, maybe they don't have good health-seeking behavior. I think there's an association. That's the most you can say until you do a randomized control trial. That's when you will now be able to come out and say, we did this study and we can say that this causes this. So randomized control trials, they are like an important or a key type of research. Now, it is called randomized for a reason. It is called randomized because when we want to select the participants, the people who are going to be involved in this research. Now, before I go to that, let me just briefly explain that usually they are going to be like maybe two or more groups when we're talking about a randomized control trials. So one group is going to be what they call the group that gets the intervention. So there will be the group that you will give the mosquito net to. That's the community that receives the mosquito net. So whichever intervention it is, or maybe you want to test this healthcare app, if it achieves a particular outcome, the people that you give that intervention to, they are like one group, intervention group. And then we now have the control group, which is the people that we are not going to give it to. They're not going to be exposed to that thing that you want to check for. So they are usually like two groups. Now, it is called randomized because when we want to decide, okay, which people should get, which population should get this intervention and which one should not get it, we are not going to choose based on any preconceived notions. We are just going to basically, in fact, you can even do this balloting. You can just even write in papers and just do balloting. You are choosing randomly. Or you can use some of these applications to just generate and say, okay, participants number 2, 5, 10, 12, 13, they are the ones that will get it, and then these other ones will not get it. That's why it is called randomized. Now, the reason we are doing this, there's a concept called bias.
Yes.
Trying to eliminate bias. We are trying to eliminate bias as much as possible. As we go on, I guess we may come across it later on. Like, bias is a key thing in research. So when we do research, one of the things we try to eliminate is bias. Remember that research is the basis for synthesizing evidence. It is what we are going to make decisions on. So we don't want to be biased in any way. So the reason for these randomized control trials is to reduce bias. So it's not like please, can we mute our mics? So it's not like we sat down in our houses and said, I like this community more. So let's give this community the intervention and let's not give it to this other community. No. So just please, can we mute our mics? It was just random. It was just random. So that's it. Please, can we mute our mics? It was random. So that is why it's called randomized. And when the result comes out, we can trust it more because to a good extent, we try to eliminate bias. So that is randomized controlled trials. And then there's now the non-randomized trial. It's just like the opposite of randomized controlled trials. So for instance, I may say I want to see the effect of coffee. Does coffee help increase productivity among workers? And then I would keep coffee jars in the office and say, when you come, if you like, you can take coffee if you want. So I'm not interfering. The people who want to take the coffee will take it. Those who don't want to take it will not take it. That's non-randomized. So it's basically the people that are going to decide whether they want to use that intervention or they don't want to use it. Next one is quasi-experimental designs. Quasi-experimental designs, what is happening there is it's almost like the randomization was done for us. So an example is let's see. So maybe maybe there was a community where, for instance, I think online I've been seeing a lot of good news or good things about Abia State. So let me say in Abia State, the healthcare is now free there. I'm just assuming, like I'm just giving an example, not like I'm saying something I'm certain of. So let's say healthcare is free there. So and then in another state, healthcare is not free. So I now want to see, okay, so let's just check in these two states, healthcare being free, does it entice more people? Does it improve or does it make more people want to see the doctors when they are ill? Now, it is not you, the researcher, that introduced that intervention. It was just done and your own checking it. So that's quasi-experimental design. Okay. Yes, so I think we can stop here for today. This is 8:51. So please, if there's any question, if there is any contribution, if there's any observation, if there's anything, I think the floor is open to us. So we have the remaining 10 minutes for us to just talk. Thank you.
Good evening.
Hello, good evening.
Hello.
Hello, good evening.
Yeah, I think
Can you hear me?
we're talking. Okay, I can hear you, Temilade.
Can you hear me?
Yes,
Okay, good
yes, I
evening.
can
Please, can you repeat the non-randomized control trial, please? Can you re-explain? I beg you. It's
Okay,
a bit confusing.
okay. So I'm going
Thank
to
you.
explain again. So for non-randomized, for randomized, we already explained it that you, the researcher, you are the one who is going to sit down and maybe just use balloting, or you use, like, there are apps that you can use to generate and say, okay, these are these are the people that will get intervention, these are the population that will not get intervention. That's randomized. Now, for non-randomized trials, it is not you that will decide who is getting the intervention or not. You make the intervention
Okay.
available, and then the people can decide whether they want to use it or not use it, basically. But you are not the one that is
Okay.
now going to say, yes, you, this group, I want you to take the intervention. This group, you are not going to take it. No, this one is just non-randomized. You are not the one doing anything there. You are just watching, and you have made intervention available, and then those people will decide whether they want to use or not. Then for quasi-experimental design, it is used when it's almost like the intervention has already been done for you, and all you are going to do is like study it. For instance, there's an example here in our
Okay.
notes. It says studying the impact of policy changes on smoking rates. So let's say, for instance, that they said if you buy one packet of cigarettes, you are going to pay tax of 500 naira. I'm just using that as a very crude example so we can get it. And then there's
Okay.
another community where they don't have that type of policy on like whether there's going to be tax or no tax on cigarette. Like, you can just walk in and buy your normal cigarette and be on your way. And then there's another community where they say we're going to tax people that sell cigarette or people that buy cigarette, something like that. Now, you, the researcher, you are not the one who brought about that intervention. What you are basically doing is to go there and study the populations and say, okay, this
Okay.
population, they have tax on their cigarette. These ones they don't have. So let me now see if it affects smoking rates. So that's what quasi-experimental is. I hope that helps
Mental
it.
ease.
If there's anybody that can explain
Yes, it
better,
does. Thank
can
you.
help us.
Thank you.
Thank you.
It's
I think
clearer.
somebody's hand. Okay, thank you. I think somebody's Chido's here.
Yeah, thank you so much, Ma, for the explanatory lecture. It was quite interesting, though I joined in late. So I want to find out which of the class this type of experiment falls into. Actually, I work with an NGO, and at the moment we are doing what we call active case finding, TB active case finding. So we go from community to community, and one thing that informs the choice of the community is what we call EWOS alert.
Is what?
So the EWOS alert tells us, it's called EWOS alert. Early warning is called early warning, something, early warning sign, something like that. So we use that to map out communities with hotspots, TB hotspots. So we go to those communities to pick up TB cases using what we call portable digital X-ray machine. So from the samples we got, over time, we're able to discover that children are not really captured. So for us to be able to capture children, what do you think, what type of methodology or research approach do you think we can use to capture children under 5, knowing fully well that TB is airborne and the X-ray we are using, we can't use it for under 5 children because of the radiation. So I don't know what sample method we can use to capture children under 5 so
To
that
be
they can be
honest,
part
I
of
think,
our intervention.
yeah, I think it's quite long. Like I got lost at some point where you were explaining it. Um, I don't even know if there's still time, but okay, kindly just type this question on the group so that I can like read it because I think I got lost at some point where you were explaining the study that you are doing.
It's
Please
okay.
just
I will write
type
it
it
down.
out on
It's
the
okay,
group.
ma.
Yes, thank you.
It's okay, I will. Thank you so
Yes.
much, ma.
All right,
All
thank you.
right.
Yeah, when is the next class, please?
I think we have to decide on the group when the next class we hold. I think we have to decide on the
Do we
group.
need to decide?
You
Are you
said?
free to take us like? Are you free to take us like
Tomorrow will be
every
nice.
day?
We are free. Oh.
Like just take us every day. We don't have time.
Especially in this, what is it called? Design, whatever.
Sorry. The group, is it the WhatsApp group I should send it? Or
Yeah,
this
Yes,
the
yes,
chat room?
please.
the
Yes,
general
please.
group.
The
Yeah.
WhatsApp group.
Okay. All right, no problem. Thank you, ma.
So like
Thank
we're
you.
fine to take us every day. Oh. I beg. It's to every don't mind do. I beg go.
Okay,
Every
so
day.
I'll ask on
Sorry,
the
Let us
you
be
group.
must be
having break.
considerate. You may be
Let
busy,
us be
but at
having break
least
because we
Apart
have to
from
study
Wednesdays,
too.
apart from Wednesdays, please let's have it every day.
Mm. No.
selfish.
The earlier
Apart
the
from
better.
Wednesdays.
Okay,
So can
okay,
finish
we're
it on.
going to, I'm going to put up maybe I would ask the admin to put up a poll or something on the group, so that there'll be more persons to decide. And also, well, we need to still talk about like what we can use because I was using Zoom for us to be able to record. So I don't know what we have to talk about like how many days in the week we can have the classes. I think maybe 3 days or 2 days. And
No,
then
3 is
two is
okay.
too small. Two is
3 days
too
is
small.
okay. 3 days
Yeah.
is
Two is
okay.
okay.
We only decide
3 days will be okay. It
oh,
depends on your
Three
home
days is
timing,
okay because
Chidima. If you are
taking
free,
lecture every day. Mm.
we won't mind
Well,
every
3
day.
days. 3
okay,
days
That's the
is
truth. If you
okay.
are free, we won't mind you to take us every day.
No, but it can be
Hey,
every day.
But
We
we
also
have to
need to be
but
consider
considerate.
you. Uh-huh.
Yeah, it can
You
be every
especially.
day.
okay, no
Mm-hmm.
problem.
so
No
Just check
problem.
your
a
timetable and
day.
tell us. Then we'll organize our own timetable too,
Okay,
or
no
we'll
Okay,
arrange
dear.
problem.
ourselves.
Thank you very much. Thank you everybody for
Really
coming. It's
appreciate.
Yeah.
already,
Please,
yes.
another course we would like is epidemiology. I beg you, in the name of God.
Okay, 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 we'll work on that. So the thing is,
Please,
like, okay, no problem. We'll work on it. And I'll get back to us regarding the
you should apply for
epidemiology.
lecturing job in Miva. Oh. You are very good at this thing, no?
Thank you so much. Thank you. All right,
I
good
thought
night,
you opened one
everybody.
box from my
All
head.
right. Thank you very much. We really
Yeah,
appreciate you,
You.
thank
Chidima.
you. Good night,
Thank
everybody.
you so much,
Thank
ma.
you. Good
Yeah,
night.
We
thank
appreciate
you.
more grace.
Hope the
good
hope
night.
hope
Thank you, ma.
hope the we're having the recordings.
Yes, yes, I will make it available. I'll make it
Okay.
available. Yes, thank you very much.
Thank you. I really
All right.
appreciate.
God
God bless you.
bless. Thank you.
Thank you very much. You're nice.